Hi, we're here today with Dr. Jose Luis Lopez, the medical director with Beacon Stroke Program. Dr. Lopez, thanks for joining us today.
Thank you for having me. Good afternoon.
So, we both know that COVID has many people scared, but patients need to realize that if they have a life-threatening condition like stroke and they don't receive the care that they need right away, it can be very, very dangerous. So let's talk a little bit about what we're seeing here at Beacon in terms of the COVID-19 pandemic and its effect, the impact it's having on people with stroke.
Yes. Well, here within our Beacon Health System, we're concerned. We're concerned that people are not seeking emergency care for symptoms when they're having symptoms of stroke and heart attack. And these are appropriately in the eyes of the patients going through this in the concern over COVID-19 infection. We are looking at what has been happening over the last several months. And by looking at the numbers in terms of our volumes, we're seeing within our Beacon Health System Stroke Program cases that typically, in comparison to prior years, give us a certain number of expected times that we're seeing patients come in that we are able to assist in providing them the medicines to help reduce the permanent and effects of disability from stroke. Those numbers are going down significantly. And this is unfortunately something that in the literature, there are now case reports and being put forward that it is something being seen in stroke centers across the country and in other parts of the world. We are experiencing a significant effects of this COVID-19 pandemic. We have our colleagues in other parts of the country and other parts of the world that have gone through this perhaps at an earlier phase than where we are. And we are seeing that those same trends that we're experiencing here are also what others are seeing in their hospital systems.
That's a scary reality. How much time does someone have to be able to be treated from stroke? I mean, if people might stay away or wait longer, how much time do they have before there's damage?
Well, appropriate treatment can be provided to patients who are suffering of stroke, but it has to be in the context of their presenting to our emergency departments early enough. Medicine must be prescribed within the guidelines that we have within 4.5 hours of when stroke starts, as well as there is additional consideration of removal of the clot from the brain that should be done within 6 hours and sometimes within 24 hours. What it comes down to is that the less time passes before the treatment makes it just more likely that somebody will have a better outcome in the context of a stroke.
The saying is that time is brain, right?
Yes. For every, I mean, what we're really talking about is that for every minute that goes by where a person doesn't have the appropriate blood flow to the brain, 2 million nerve cells would die. And that's where every minute counts.
Let's just refresh people's memories, what are the signs of stroke?
So stroke can show different signs depending on which part of the brain is affected. And I think that the good way of remembering the signs of stroke are to think of the word FAST, and as an acronym, FAST. F standing for face drooping. A standing for arm weakness, extending one's arms and seeing that there's an asymmetry in the strength of being able to sustain the arm against gravity. S for speech difficulties, having slurred speech or having trouble understanding or language or being able to get words out. And T standing for time, meaning time to call 911. So if simply being aware of the word FAST and remembering the acronym to help remember what the signs of our stroke are in order to activate that emergency medical service system and calling 911, whether it be oneself and particularly friends and families that, again, are perhaps witnessing a loved one go through one of these events.
What if someone believes they had these signs or symptoms of stroke, but now they're feeling better? What should they do?
People should call 911 if they're experiencing any signs of a stroke. In the emergency departments, again, we are ready and prepared to give these medicines, these clot-busting medicines, and again, as I said before, even pull out clots from the brain to help reduce that permanent disability of the effects of stroke. And in the context of what a person may be experiencing, sometimes there can be an under recognition of perhaps other things that their bodies are going through, and the brain is demonstrating symptoms for which, again, that's where coming to the emergency room and seeking emergency care to make sure that we help keep it from getting worse again and allowing a person to have a greater likelihood of a better outcome from all of this.
And finally, Dr. Lopez, what reassurance would you give to area residents, to the community, about measures we have in place, what we are doing if they are fearful, but they really need to seek care, especially for stroke? What reassurance can you give everyone?
So we are all in this together as a medical community, not just here within our Beacon Health system, but as a region, as a state, as a country, and as a world. We are learning and sharing information and data, and within the context of stroke, we have made changes to our systems that reflect what we have to consider in concern for infection, and concern for keeping our patients safe, keeping our healthcare workers, nurses and doctors and staff safe, and minimizing the propagation of this infection. What that means is that when a person is calling 911, or at the very front line, our emergency medical service providers, they are in tune with needing to find the ways to ensure that a person is being brought to the hospital in a way that is preparing the emergency department to receive them if there's concern for infection or not, and protecting that patient should they actually not have symptoms of exposure or symptoms reflective of this COVID-19 infection. Within the hospital, again, our stroke teams have been we've modified how protocols are carried out in order to, again, minimize our patients' exposure and our healthcare workers, and making sure that we are maintaining and extending our system in a way to take care of our community when these situations arise.
So the bottom line truly is seek the care you believe you need from
Yes,
us.
absolutely.
And time matters.
Time is brain.
Dr. Lopez, thank you so much. Appreciate your perspective.
Thank you very much for having me.